Thank you so much. I hope you're all doing well. Welcome, welcome everyone. We're so excited to have you join us. Hope you're enjoying your lunch, whatever you're doing. Thank you so much for being here. And happy to welcome you to our LA County Perinatal and Early Childhood Home Visitation Consortium webinar on empowering home visitors and direct service providers, understanding childhood vaccines, and addressing hesitancy with care. Before we get started, if you're not familiar with our home visiting consortium, just to give you a brief background on our work, the Los Angeles County Home Visiting Consortium brings together more than 60 home visiting programs, family and child health organizations, as well as community partners. Together, we strengthen LA County's home visiting system through shared training and resources, research and data collection, improved referral pathways, and advocacy for policies that recognize the vital role of home visiting services. If you are interested in joining our collaborative or finding more information about our work, I did include a QR code for you to scan, super easy just to get more familiar with what we do. Before I introduce our speaker for today, I do want to remind us of a few housekeeping tasks. Just a reminder that this presentation is being recorded. The recording and materials will be sent out in a follow-up email, and then we also do upload all our trainings as well as the materials that our speakers provide to our website. So no worries if you're not able to join us today or you want to review the information afterwards, we will have that uploaded on our website. And then also a friendly reminder, if you do have any questions, please use the Q&A box to submit those. And then at the end of the webinar, we do ask kindly if you fill out our end of webinar survey. At the end, your feedback is really, really important to us. We do go through all of those evaluations to see what trainings we can put on next for you and the community that we serve. So again, thank you all so much. And with all of that being said, I'm really excited to introduce our presenter today. Our speaker is going to be Dr. David Higgins. A little bit about Dr. Higgins. He is a pediatrician and a preventative medicine physician based in Colorado and an assistant professor of pediatrics and public health at the University of Colorado Anschutz Medical Campus. He serves as vice president of the Colorado chapter of the American Academy of Pediatrics and as an immunization representative. Dr. Higgins practices primary care and conducts research focused on vaccine delivery, communication, and policy. His work centers on supporting clinicians and community-based providers in having effective, culturally responsive conversations with families about vaccines, and he regularly collaborates with public health agencies, health systems, and professional organizations to improve vaccine access and build trust through clear, compassionate communication. Dr. Higgins, we're so excited to have you join us today. I will hand it over to you to get this training started.
Wonderful. Thank you so much. So let me just get my slides pulled up here and make sure that you're seeing them correctly. It looks like you should be. All right, great. I'm going to make sure the chat's open here too. Okay, well, hey, thank you so much for having me today. I am actually really excited. I speak with a lot of different groups in the world of child health, and I'm really excited to speak to all of you today. The work that you do through home visiting and direct services is just incredible, and you have the opportunity with these families and with these expecting or new anxious parents to be such a guiding light right now and help them navigate what's going on. And so I just want to say thank you for having me, and I'm excited for this day. So here's what I'm going to do today. First, before that, let me say I have no relevant financial relationship with anything in this talk. I do recommend vaccines to my patients. That's my only disclosure. So here are the objectives, and here's what I hope you get out of today. First, I want you to gain an overview of recommended vaccines. Now, look, I give hours and hours of lectures on all the vaccines to health trainees, and that's not what I'm going to have the time to do today. It's going to be really the high-level vaccines, the important ones, and I'm going to isolate specifically the ones that recently recommendations from the federal government have changed and are different than what we as pediatricians recommend. Then I want you to understand which vaccines are most time sensitive and why. How do you prioritize discussions? And how do you help families navigate barriers to getting vaccinated? And then probably the most important, hopefully the most important part of this talk for you all is learning communication techniques for responding to common fears, myths, misconceptions, questions, concerns, all of those things that I know you're hearing when you're working with families. And doing it in a calm, non-judgmental, empathetic way that builds trust rather than increases pressure. And really, we want to build trust with these families over time. And finally, I'm going to incorporate some cultural considerations, as I know that you work with a variety of different families with all sorts of backgrounds and different contextual factors to what their life is like. Okay, so quick on the agenda. Here's what we're going to do. I'm going to start with some information about the childhood immunization schedule. Then I'm going to talk a little bit about barriers to vaccination. And finally, I'm going to wrap up with communicating about vaccines. At the end, I hope to leave time for questions and answers. And please, I welcome any question, any question. So if we were in person or I could have you come off mute, I would say, how effective is the vaccine that's sitting in these vials in this picture? And let's pretend it's the influenza vaccine. And when I do this to health trainees, they often say, well, some years it's better than other, and some people shout out different numbers. But the reality is when this vaccine sits in these vials, it's 0% effective. Vaccines alone don't save lives. People getting vaccinated saves lives. It's really important to remember that. Okay, vaccines are one of humanity's greatest public health achievements. We have been able to eradicate, eliminate, and reduce so much disability, so much death and harm from vaccine preventable diseases. And yet, even the best vaccine, if people don't accept it, it's not effective at all. And vaccines work. Vaccines are an American success story. Immunizations protect children every day. When you look between 1994, when the Vaccines for Children program started in 2023, it's estimated that vaccines prevented more than 500 million illnesses, more than 1 million deaths, and saves us collectively more than $3 trillion. So they really are a success story. And vaccines, both the discovery and the development of vaccines over the past century and a half has really been centered in America. It has been on the shoulders of American scientists and researchers and health professionals and public health professionals. It's their work that has given us vaccines. But hey, there's a problem. And I'm not going to linger on this because I think that you all know this, right? So if you look at school and childcare required vaccines, and each state's different in how they, in what vaccines they require and how they implement that. And I realized that actually your state in California is somewhat unique in the level of requirement for vaccines compared to some states, like my state here in Colorado. When you look at the rates of these vaccines, they are lower than we want. Okay, so we want the MMR vaccination coverage. That's the vaccine that prevents measles. Highly, highly contagious. You know this. I know that you've got some, I believe I read on the news recently that you have some measles in California. We've been dealing with multiple states in the past year. And we want that rate to be high, higher than 95% to prevent it from spreading like wildfire through our communities. Well, unfortunately, when you look at the colors on this map, very few states are at that rate. And I want to emphasize that if you zoom in on any state, even if you take California and you zoom in, you say, hey, overall, California has a good MMR vaccination rate. Well, outbreaks do not happen at the level of the state. Outbreaks happen at the level of local communities. So even if a state is doing well on their overall rate, outbreaks can happen in in neighborhoods, in towns, and in communities if that local area has a low vaccination rate. And in states where there are non-medical exemptions as an option from required vaccines, we have seen an increase in those. Now, I do want to point out that it's still a very small percent. If you look at this figure here, we still are about 3.5% of children that are able to claim an exemption are claiming a non-medical exemption. And so it still is a low rate, but it's concerning that it's rising. And let's look at some of our other vaccines, like our respiratory vaccines. So every year, we see influenza coverage below our target. We really had not reached that target ever before, but unfortunately, since the start of the COVID-19 pandemic, we have become the rate of vaccination for influenza has gone down consecutively every year. And when you think about that, every single one of these children, of these kids that did not get influenza vaccine are at an increased risk from going to the hospital, from serious complications of disability or death. And we see evolving attitudes toward vaccines. Okay, and there's a lot of data on this, of people's opinions. What we see are shifting attitudes both about things like the safety of vaccines, as well as vaccines in this moment becoming more partisan. Now, I do want to say that even though we have seen a shift in some of these types of attitudes, the take-home message I want you to remember is that actually across political ideologies, across geographies, across all sorts of ideologies, what we still see is that most parents choose to vaccinate. Most parents want to vaccinate their kids. And sure, they understandably have questions and concerns. What parent wouldn't right now with everything that's going on? But in the end, most parents are still choosing to vaccinate their kids. Okay, I am going to really quickly just explain the process from discovering a vaccine for a disease to that vaccine becoming available to the public. I think it's important that you all just have a really high-level overview of this. I'm not going to take long on this slide. Again, I could speak about this for an hour. But the process from discovering a vaccine starts with basic research. Okay, this starts with years, often decades, of incredibly smart scientists doing basic research on a bench, looking at proteins and immune responses and things like this, and trying to figure out how we can develop and discover a vaccine that will prevent a disease. After decades of work, the vaccine then enters clinical studies and clinical trials. Most of you probably don't even hear about vaccines until they enter this phase. And most of you probably don't even hear about some new vaccines until they enter the third phase here. Phase 1 and 2 are much smaller studies done with dozens to several hundred people. And they are not ones that often make the news and you hear about. If, after passing those and showing safety and effectiveness throughout that entire process, then a phase 3 trial, much larger, tens of thousands of patients will happen. Now, after that phase 3 trial, the FDA is charged with reviewing whether the vaccine should be licensed for use in the United States. The CDC then is charged with saying who most benefits from this vaccine, who in the population should be getting this vaccine. And finally, the process doesn't end there. Following vaccine approval, following large, rigorous phase 3 clinical trials, there's ongoing post-approval monitoring and research. Some of this is research and monitoring that the company that developed and manufactured the vaccine has to do. Some of this ongoing safety includes different mechanisms and tools that are run through the CDC, through the FDA, through Center for Medicare and Medicaid Services. There are a number of different tools that we have to continually ask, are vaccines safe? Do we see any concerns about these vaccines that we've approved? Now, things have changed recently, so I want to mention this. The American Academy of Pediatrics actually was the leader in making vaccine recommendations for children long before the ACIP and the CDC were making recommendations. In 1938, the American Academy of Pediatrics came out with their first recommendations on vaccine preventable diseases here in what's called the Red Book. Now, this was only 8 pages long and covered 18 diseases. Now the Red Book, you can't see it very well in this picture here, but it's very thick, and it's kind of the Bible of the pediatric infectious disease world and has a lot of information in it. So long before the ACIP, the AAP was recommending childhood vaccines. What happened was that through the 1960s, as we developed new vaccines for things like polio and measles, the CDC would hold ad hoc committees and make recommendations on these vaccines. In 1964, they realized, look, we have these great new vaccines that are coming, and we need a different approach than one-off committees for recommendation. That is when the ACIP was formed. And it was formed to consider the disease epidemiology, burden, and vaccine effectiveness and safety, along with considering implementation issues. For several decades, the AAP, the American Academy of Pediatrics, and the ACIP and CDC made separate recommendations. In 1995, there was the first effort to harmonize those schedules. And the first harmonized schedule was almost completely harmonized, although you'll notice even here, the AAP and CDC had different recommendations on the second dose of the measles vaccine. But those have essentially been harmonized since this time, with very few exceptions and small nuanced differences between what the American Academy of Pediatrics recommends and what the CDC recommends. Okay, so let's just talk about why are your parents or expecting parents, why are they confused? And really what I want to talk about is, okay, what's changed at the federal level? What has happened this past year? And this is going to be a short overview, but I think it's important for you to know, to understand why people are confused. So here's what happened from April through December of 2025. ACIP members. The ACIP, again, go back to that slide that I showed you of the vaccine approval and recommendation process. They're an independent committee that advises the CDC on who should receive vaccines. Okay? They were fired, overnight fired, replaced with new members, and unfortunately, several of the new members are either unqualified or have been vocal vaccine opponents. The June, September, and December meetings of last year were widely criticized by the medical community and the health community as platforms for misleading claims. The American Academy of Pediatrics and other medical and child health organizations continue to reinforce the critical role that the ACIP had been playing. And last year, the AAP published their own recommendations in a separate schedule. That was the 2025 schedule. Well, on January 5th of this year, appointed leadership of HHS announced major changes to the U.S. childhood vaccination schedule. Okay, major changes. We have never, in the history of the vaccination schedule, going back almost 100 years, never made changes this drastic overnight. And overnight, they said several routine vaccines were moved to this shared clinical decision-making recommendation, or to what we call high-risk recommendation. The HPV vaccine moved to a single dose, okay, starting at age 11. And the reasoning for doing all of this was to restore trust in vaccines. They also gave the reasoning that this was done to align with peer nations. And one of the nations that was repeatedly brought up as a peer nation that we should more closely resemble was Denmark. Well, that's very misleading. So Denmark is actually the outlier, kind of on the other end of the spectrum, okay? Denmark seems to be chosen to make the U.S. schedule kind of look bloated compared to others. But in reality, when you look at our vaccine recommendations in the U.S., very similar to many peer countries like Canada, Germany, Italy, Australia, South Korea, Israel, and the list goes on, okay? Um, and, part of the other problem with this was that vaccine schedules are not interchangeable lists. You cannot just copy and paste public health from one country to another. Different countries have very drastically different populations, different health systems, different sizes, just the vast number of people, cost and resource considerations. There's so much that goes into these recommendations. It cannot be as simple as just copy and paste. And one of the things that I've spoken about a lot that I think was ignored is the fact that, okay, the US did recommend more vaccines than some countries. That's not necessarily a bad thing. We are a leader in preventing childhood disease. That should be seen as a good thing, not a bad thing. And talking to some colleagues that have worked in some of these other countries, including a colleague that has worked in Denmark, they actually were hoping when they were working in those other peer nations that those nations would adopt some of the vaccines we give. And so again, we were a leader in preventing childhood disease. I believe we still can be, but that it wasn't the message coming out of the changes from the federal government. So I want to review with you today the 2026 AAP immunization schedule. And I'm not going to go again through everything. I don't have time to do that, but I want to focus especially on those vaccines that now differ in recommendation from the CDC. So the 2026 AAP recommendations came out last month, and they're largely unchanged from the 2025. This is really important for you to know. Essentially, almost all of the professional organizations, health organizations that do child health work formally endorsed the American Academy of Pediatrics immunization schedule over the CDC schedule. These are the 12 organizations that did it when the schedule was released. There is a growing list of other organizations that are saying this is the schedule we believe will keep children in our communities the healthiest. Okay, let's talk about some of these diseases real quick. Some of you know a lot about this. Some of you maybe have not heard as much about these diseases. One of those on the schedule is RSV, respiratory syncytial virus. RSV immunization is recommended for all infants under 8 months of age during the RSV season. And this depends on mom's RSV vaccine status. Okay, so actually the recommendations didn't change from the CDC, but it made it very confusing. This got moved to the high risk table. But if you read the footnote, all babies that are born to moms who didn't get the vaccine are high risk. Very confusing for families, okay? And RSV is a disease that causes a lot of hardship and burden on families every year. As a pediatrician that still sees patients, in addition to the other work that I do, I am swimming every winter in RSV, right? It is just all over the place. And it's the leading cause of hospitalization for infants. Now, mom getting a vaccine during pregnancy or newborns getting the immunization offers protection. And actually, it's been incredible. So in the past 2 years, since these have become available, we have seen a decrease in hospitalizations down over 80%. It's incredible. Right now in Colorado, we're seeing a bit of an uptick in our RSV locally. And I'm going to knock on wood. I hope that, this doesn't change things, but I have been really surprised at how little RSV we've seen, especially compared to some of the recent bad seasons prior to these products. And so RSV is so important, but your parents are probably confused because it moved in the table of recommendations, even though it didn't actually change. So let's talk about influenza vaccine. Influenza is recommended for all children starting at 6 months. Now, look, this vaccine is not perfect, and often people talk about that. Well, it's not perfect. It doesn't always prevent the flu. It's not. You're right. But a seatbelt isn't perfect, and yet every time I get in the car, I put one on. Because historically, we know that over 80% of influenza-associated pediatric deaths occur in unvaccinated or incompletely vaccinated children. And children that are young, those younger than 5, and especially those infants and toddlers younger than 2 years old, they're especially vulnerable to severe disease, to being hospitalized or death. Last year, unfortunately, we saw our worst pediatric influenza year in over 15 years. And again, what we saw last year was that most of those deaths were in children that were incompletely vaccinated. The current season is quite severe. However, the vaccine is working. I can't tell you how many times I heard, well, the vaccine doesn't work this year, when there was some early data that gave scientists concerns, but actually it is still working. It's still preventing hospitalizations. Okay, let's talk about hepatitis A real quick. This is one that maybe you don't know as much about, but is super important. So hepatitis A vaccine is recommended for all children starting at their first birthday. Now, prior to widespread vaccination, there were 20 to 30,000 cases a year of hepatitis A and about 100 deaths a year. And what has happened is vaccination has reduced the rate of hepatitis A in our communities so that now it is actually pretty rare. However, it is only holding it at bay. Hepatitis A is widespread around the world. And if our communities stop vaccinating against hepatitis A, it is going to come right back. Okay, so the vaccine worked, and now we have a lot less in our community. But unfortunately, if we stop, it's going to come back. I want to mention hepatitis B. Hepatitis B is recommended for all infants within the first 24 hours at birth. Hepatitis B is extremely contagious, especially during the birthing process. And unfortunately, if a newborn gets hepatitis B or a young infant gets hepatitis B, they're extremely likely, over 90% possibility, that they will go on to develop complications. And these are some serious complications: liver cancer, cirrhosis, which is liver damage, and unfortunately death. Prior to widespread vaccination, there were 20,000 cases a year of this in children. Now, I said that infants can become infected at birth. And a lot of the concern that I hear from parents is, well, I had a hepatitis B test, which we routinely do at that first visit at 8 weeks, and it was negative. There's no risk to my baby. Well, unfortunately, our testing's not perfect, our screening's not perfect, and moms can become infected after that first screening. And we don't always catch that. So the birth dose is a safety net. But here's the other misconception I hear all the time. Okay, I am through the birth period, and now there's no way my baby, my toddler, can get hepatitis B because it's only transmitted through sexual intercourse or using IV drugs. I hear it all the time. That's just not true. Absolutely, young children, infants, toddlers, and school-age children can get hepatitis B from common exposures to blood. Okay, this can be bloody nose, sharing toothbrushes, things like that, right? They are exposed to blood in their normal everyday things that they do. And prior to widespread vaccination, about half of the cases of hepatitis B in young children were not from birth. They were from common exposures. All right, let's talk about the rotavirus vaccine real quick. So rotavirus is recommended, the vaccine is recommended for all infants starting at 2 months of age. Now, this used to be called winter vomiting syndrome. Well, I guess you still call it that, but fortunately, we don't use that term anymore because we don't see it nearly as often. Prior to widespread vaccination, there were 50,000 hospitalizations a year. I mean, in the middle of winter, you would have multiple kids admitted to the pediatric ward that were on IV fluids because they were so extremely dehydrated. Now, since routine vaccination, we rarely see this. There are other countries like Denmark, that do not routinely vaccinate against rotavirus. And talking to pediatricians that have worked there, they wish and hope that they will adopt the rotavirus vaccine because they still see this frequently. They still frequently see kids hospitalized for rotavirus. Okay, I am going to, because of the age of most of the children and families that you are serving, I'm going to skip over, but there were some changes to the meningitis vaccines as well as HPV vaccine. If you have questions about this, I'm happy to come back later. But for the sake of time, I want to shift gears. And I want to start talking now about barriers to vaccination. How do we navigate these? Okay, I'm showing you this framework. This is called the Social and Behavioral Drivers of Vaccination Framework. Now, I know you see a framework and you're like, oh, this is getting academic and like this is kind of, frameworks are not your thing. But I like this because it breaks it down in a really simple way. It's a simple framework. Okay, first, a parent or caregiver has to be motivated to get their child vaccinated. And then, in order for vaccination to happen, they have to overcome all sorts of practical issues. Okay? So those are the two pieces, the motivation and the practical issues. And under practical issues are common things that you think about, like access, like cost of vaccines, like availability and convenience of vaccination services, like service quality. Okay? If they bring their child in and they're really not, the quality of the vaccination service is not good, they might be less likely to come back in the future. Now, the motivation piece involves all sorts of things. And for the rest of my talk, I'm going to talk a lot about this motivation piece. This side of things is often what we're talking about when we talk about vaccine hesitancy. But before we talk about vaccine hesitancy in 2026, I want to rewind the clock several hundred years. Vaccine hesitancy and having concerns about vaccines is as old as vaccines themselves. This is a picture from 1802 of a physician administering the cowpox vaccine. This was a vaccine that was discovered only several decades prior that prevented smallpox and was the basis of how we have eradicated smallpox from the world. Now, if you look carefully at this picture, what you will see is that it's a satirical picture showing cows growing out of people's bodies. Even in 1802, there were these myths and concerns about vaccines. If you fast forward about 100 years, this is a picture of the Anti-Vaccination League of Canada and some, protesting vaccines and protesting the introduction of vaccines. Now, let's fast forward to our current moment. You all know this. Social media has completely changed our information ecosystem. While vaccine hesitancy and concerns are not new, what is new is how parents and caregivers receive and are able to process information. Now, instead of hearing concerns about vaccines from a neighbor, from someone in their mom group, or someone in the somebody on the television, but something that we all see, instead they're just bombarded with information about vaccines, whether they're looking for it or not, at all the times that they're looking on social media. Right? They're exposed to it. They're not even looking for questions. They're not even looking for answers about vaccines. They're just scrolling through their feed and something pops up. So it absolutely has changed the information environment. Now, vaccine hesitancy and vaccine concerns are on a continuum. On the bottom of this pyramid are people and parents who accept vaccines with very few questions. And actually, there are a lot of people like this. There are a lot of parents. They're like, yep, I love vaccines. They're great. When can we get them done? In the middle here, there are parents and caregivers who have questions and they're hesitant. There are some that think, okay, I'm not completely against vaccination, but I'm not sure I might selectively vaccinate or wait and delay vaccination. And then at the top, there are parents and caregivers who say, nope, we're not going to do any vaccines whatsoever. Now, I want to be clear on several things here. One, the percent who refuse all vaccines is rare. For this stat has held true even in current years, but the percent of children who have not had any vaccines by the time they reach 2 years old is around 1%. This is a small proportion of kids. And some of those kids, it's not because the parents didn't want it. It's because they were trying to overcome those practical issues that I showed you earlier. I should put an even smaller little thing on top of the pyramid and say the percent of parents who are actively spreading misleading claims about vaccines and are maybe what I would call anti-vaccine activists is minuscule, is tiny. And that's really important when you're talking to parents. Parents are just confused, concerned, and care for their child's health. They are not anti-vaccine activists. Okay, again, I already said this once, but I want to say it again. Most parents vaccinate their children without concerns, without significant hesitancy, according to the recommended schedule. This is the honest truth. And even in the moment that we're in right now. Yep, there are some very concerning trends. And at the same time, most parents are continuing to vaccinate. And this is an important thing for you to recognize because sometimes parents are in their little social media or information bubble, and all they see are parents not vaccinating or declining vaccines. And they may mistakenly think that's what all the other parents are doing when that's not the case. So I think it can be really powerful to share with parents that, hey, most parents are choosing to vaccinate their children. There are many, many different reasons for vaccine hesitancy. I can't even go through all of them today. But I want to give you two big buckets. There's the bucket of fears and phobias, and then the bucket of distrust. Fears and phobias, that bucket contains all the concerns about safety, about chemicals or products in vaccines and things like that. The distrust is a little bit more general, like I'm suspicious of the person recommending this or the health system. And that often is from a personal experience that they had, right? That may be from a personal experience where they weren't treated with the best care in the health system. That might be where, either themselves or their community or their family members were actually mistreated in the health system. I think it's really important not to remember that that's often also the case. So again, there's fears and phobias. Sometimes there's kind of a distorted risk perception. And look, we all do this. It's really hard for us as parents to have kind of a very rational risk perception. We get worried about our kids. That is part of our job as parents. I already talked about distrust. There's also this problem with perceived self-interest. So, the message that you should vaccinate your child to protect the community often does not land well with parents. Okay? Because with parents, sometimes they hear you saying, you're asking me to vaccinate my child with something I think is dangerous for my child to protect someone else. And that doesn't always resonate with them. There's also a lot of values and concerns around wanting to choose and have their own freedom to make their own decisions. And then obviously there's worldview and politics that are playing even more of a part now. So here's some of the common things that I hear, right? Too many too soon. I hear this a lot. Well, too many too soon is a common misleading claim that doesn't recognize that actually compared to the vaccine schedule, say in 1980, where there were 3,000 antigens, these are the little pieces of a pathogen that the body sees to build an immune response. There were 3,000 antigens, whereas today's schedule actually has 320. Significantly fewer. You're going to hear, and you've already heard a lot about aluminum, right? Well, I don't know. There's aluminum in there. And aluminum, the reality is the aluminum is the third most abundant element on the earth. It is everywhere. It's in the food we eat, in the water we drink, in the air we breathe, okay? And kids get way more aluminum in all of those settings than they do from the vaccines themselves. And we have actually looked and asked and said, hey, is there any evidence that the amount of aluminum in vaccines correlates with these diseases like autism or allergies or autoimmune disorders? We have some good data from over 1 million kids showing there is no evidence that those two are associated. And yet, the misleading claims and the concerns continue. Part of the problem is this really difficult to understand idea that, look, just because two things are correlated doesn't mean one causes the other. I love using this illustration. If you look at ice cream sales and shark attacks, they are directly correlated. The more ice cream sales, the more shark attacks. Does that mean that selling ice cream causes shark attacks? Absolutely not. What it means is when the weather's nice and people want to buy ice cream because it's sunny out, they also want to get in the water. And that's where the sharks are. And so the problem is that it's very easy to show two things that seem to be connected and they have no connection whatsoever. Okay, I'm going to, I already made this point, so I'm going to skip this. Now, what do families need from you right now? Let's talk about this. So families are asking us what's recommended, why are these different recommendations? They're just so confused. What they want from you is a trusted messenger that has some expertise. They want a clear recommendation. They want a clear, like, okay, what do I do? They also want reassurance that they can trust you. Now, addressing this is complicated and there's no easy solutions. There are several things that are important that you don't do. And one of those is called the data dump. So families need knowledge, knowledge matters, and understanding matters. You can give that to them, but they need it in small, digestible pieces. They do not need just a bunch of data. And just giving them knowledge frequently isn't enough. We know that it's not just about the facts. How we communicate about vaccines is just as important as the facts that we're communicating. Okay? So, when a family is concerned and they have some questions about vaccines, the first thing I want you to do is lead with empathy. Parents are understandably confused. News headlines, social media, conflicting messages. Your first move should be empathy and partnering with them. Some example language for this is simply saying something like, hey, I can see why this feels confusing. There's a lot of conflicting messages. Ultimately, this is your decision to make. Do you mind sharing why you're hesitant to vaccinate? Or do you mind sharing what your concerns are? Reinforcing that empathy and that you're there as a partner to help them navigate this is really helpful. And then I want to teach you a couple of skills from something called motivational interviewing. Now, I do not have time today to give you kind of the full communication skills on motivational interviewing, but there are several different things that you can use that are so valuable to helping a parent understand their own values, understand their own motivations, and have a much, much better conversation. So there's 5 things. One is asking open-ended questions. That's easy. You're just trying to understand where the parent's coming from. Why would you prefer to wait on the vaccine? What concerns do you have? Okay, asking these open-ended questions. And look, I know a lot of you might be thinking, I'm not a vaccine expert. I don't have all the answers, so I'm afraid to ask this. That's okay. You do not have to have all the answers when you ask an open-ended question. Parents want to feel heard. They want to voice their concerns and feel heard. Just ask an open-ended question about what their concerns are. It's important to affirm that they care about what's best for their child or their future child. It's really important to say, hey, it's clear that you want to do what's best for your child's health. You've thought a lot about this. You've read books, you've looked online, you've talked to people, you clearly care a lot. Reflective statements are also valuable. This helps you make sure that you understand what the parent's actually concerned about. It sounds like you're concerned about this. These are important because sometimes you're misinterpreting what they're actually concerned about. I also like throwing an autonomy support statement in there. Look, ultimately, this is the parent's decision. And if you feel the conversation getting heated, going into kind of politicized or polarized spaces, it's really great to just reinforce that, hey, this is ultimately your decision to make. I'm here to support you. And finally, before you give them information, Before you tell them something, before you share a handout or resource with them, ask permission. We know that when you ask permission to share prior to giving them information or a resource, that they're actually more likely to receive that information in a positive way and look into and consider that information. Okay? So you'll have these slides. These are 5 really easy skills. So all you got to do is you can literally use this word for word and plug in what's going on with the parents and caregivers that you're talking to. Okay, so I get a lot of people that say, well, does MI work for everyone? Well, actually, we have a growing body of the skills that I just talked to you about in some form. They're often, you may have had different training that called these skills different things, perfectly fine. But in some form, motivational interviewing has been tried now in multiple countries around the world. And it lends itself really well to adapting to fit the needs of every individual patient, parent, family that you are talking to. Despite where they come from, their own cultural experience and context, because it doesn't assume any of those things. It is simply a communication style. And remember that meet people where they are. And I thought about this. I thought, I don't even know if I need to include this slide, because I include this slide with some groups. For you all, you are meeting them where they are, literally and figuratively. And I know that you know these things. You have this unique, incredible opportunity because you know these families so well, and because you are in their lives to a point, to a degree that, like, often I'm not as a pediatrician, that you know many more of these things. Like, maybe how do some of their religious commitments and observances, how do they interact with what they're thinking? Okay. You might know more about their context and whether they have some, mistrust about the medical system for one reason or another. You know a lot of those things. That's great. Lean into those and say, hey, I can see why you would be concerned about this, given whatever it is that you understand about them. That the exploring that with them, you have a unique, you're in a unique position to do that. When you are giving explanations, use digestible and credible information. And I'm about to share resources with you, and then we'll move into questions. But you don't have to have all the answers. It can be as simple as, that's a great question. Do you mind if I share with you some resources that can help you with that? Right? If you don't know the answer off the top of your head, this isn't a closed book exam. You're not getting graded. You're trying to navigate this together with the families. Okay, and so it's perfectly fine to show them resources and keep it simple. Okay, why is this recommended now? Well, this vaccine is recommended now because we know if we give it now that they're going to get protection before they're exposed. That's why pediatricians recommend it now. Simple explanations help. You do not need a background in microbiology and vaccinology to do this work, okay? And look, your voice still matters. Families trust you. Evidence shows over and over again in a variety of different surveys that child health professionals are the most trusted health professionals and the most trusted source of vaccine information. And for many of you on this call, probably nurses, you're like at the top. You're above pediatricians. Nurses are at the very top of this. Trust. And look, trust is relational. That's again why I just love talking to all of you, because you are forming relationships with these families. Okay, you're not coming in as institution. You are forming relationships. And consistency and credibility in what you're saying, along with what they're hearing from their doctor, from the nurse in clinic, from all of these people, is really important. So your voice truly does matter more than headlines. I know sometimes it feels like it doesn't, but it does still matter more than headlines. Okay, before I take some questions, I want to just give you a couple of resources. Again, you will have these slides. If you're interested in any of the evidence behind how to communicate, this is an open clinical report from the American Academy of Pediatrics, if you're a little bit more interested in kind of the evidence and the background. If you have parents or you yourself are interested in some of the details about vaccines, like I want to know a little bit more about aluminum in vaccines, I recommend the Children's Hospital of Philadelphia Vaccine Education Center. They do a great job of breaking down and going into more nuance, right? Say that you have a family that's concerned about fetal cell lines being used in vaccine development and how that interacts with their own religious beliefs. CHOP's website has some great information on that. Okay, so there are a deep dive you can do here at CHOP. Immunize.org has great resources for you all as health professionals. This is not where I send families necessarily, but good resources for you, along with the American Academy of Pediatrics. For families, I love sending them to healthychildren.org. Really good articles and things broken down here. I've written some of these articles where we have tried to break down these questions that we hear all the time into really digestible, bite-sized pieces. Some families really love Voices for Vaccines. I do too. It's a family-led organization, so this is great maybe for your families that are a little bit skeptical of something that sounds like it's academic or from an institution. And also vaccinate your family. Some great kind of like testimonials and families talking to each other on these websites that I think can be really powerful. So I want to end with this. Don't forget, vaccines alone don't save lives. Vaccination saves lives. And I just want to thank you all so much for the work that you are doing in the lives, building relationships with parents, caregivers, families, and future parents. I am happy to take questions. I do some kind of public online work. I would love and be happy if you'd follow me. I don't get any money for any of that. So it is just a labor of love to try and continue to get good information out there to everyone. So thank you all for your time today. I'll stop sharing and happy to take any questions.
Thank you so much, David. Wow, you shared so much wonderful information in a really digestible way. I know you've addressed a lot of the concerns that home visitors have when talking to their families about vaccines. We did have a few questions come through the chat, or I'm sorry, the Q&A box. There was one comment. It wasn't a question, but it was a comment that said that parents have shared that they are worried about vaccinations causing autism.
Mm-hmm.
I think that's a really common concern, and like you were talking about in the little social media bubbles where you hear a few very, very loud voices repeating the same thing over and over, and it's really easy to get drawn into that. So I just wanted to see if there's anything else that you would like to share about like the myth of vaccines and autism.
Yeah, so I'd love to talk about that. It's a really good example of how a myth can become really sticky and now decades later continue. We have good evidence across millions of children and dozens of studies that vaccines do not cause autism. There is no association when we've asked this question. This myth started in 1998 when a doctor over in England published not only a poorly done study, but a fraudulent study, okay, where he benefited. He actually took money, about $1 million, to prove that the MMR vaccine caused autism. So we're talking a fraudulent study that started a lot of this concern. Unfortunately, it got out into the public sphere, right? And even though there wasn't social media back then, it spread like wildfire. And people have taken it up, and it has continued to propagate and continue to spread through our communities. So the honest truth is that there's no evidence that vaccines are associated with autism in any way. And we have asked that question and studied it over and over again.
So much. Yeah, I believe that researcher was disbarred too, and still the
Yep.
rumor just blew up like wildfire, like you said. Thank you
Mm-hmm.
for that. The next question is, how do mothers report vaccine injuries and adverse reactions? How can this process be improved?
Yeah, great question. So there is a safety website and collection system called VAERS. Some of you may have heard of this before, right? Anybody can go onto VAERS and report a side effect of vaccines. Some professionals, like pediatricians, are required to report certain side effects to vaccines when they happen on VAERS. But anybody can report it on VAERS. So, parent, sure, you can go right ahead. Now, there are some challenges with that. Unfortunately, this program called VAERS is misused because if you don't like vaccines and would like to see more misleading claims about vaccine spread, you also can go on VAERS and you could spend your entire day claiming injuries on VAERS. There's no regulation. Anybody can report it. And so if there is something that happens and is reported on VAERS, we have to do more investigation to figure out whether it's really associated with the vaccines or not. Now, I am also very open to the idea that we could make things like VAERS better. I have reported many times on VAERS. It's a bit of a clunky system. I think it could be better. And I think we could have better systems in place to quickly be able to say, okay, this concern that was reported on VAERS, is it something we need to look into more? So sure, we can absolutely improve our systems that we have, but right now we do have a system that parents can use to report something like that. And I do want to say that vaccines are, we actually have processes and tools to look at the safety of vaccines more than any medical intervention that we have. We actually look at the safety of vaccines more than anything. A lot of people assume that there's similar things in place for medications we prescribe, for procedures we do. There's not. Not that there's no safety in place for those, but vaccines have incredible safety monitoring.
Thank you so much. The next question is about aluminum. So someone is asking, why use aluminum in vaccines at all? Is it used as a preservative?
Yeah, so great question. There are multiple different things in vaccines, and one of them is whatever we're trying to teach the immune system on, okay? That might be a piece of a virus or bacteria. Sometimes there are preservatives, and preservatives are used especially when we have what's called a multi-dose vial of vaccines, where you are taking a needle and entering the vial over and over again. We don't want to inject something that's contaminated, just like we don't want to eat something that's contaminated. Aluminum is a little bit different. Aluminum is something that is used to help stimulate the immune system. So the point of vaccines is to train the immune system so that when the child or adult comes across the disease in our everyday lives, our immune system's already ready. It's already trained. Now, aluminum in some vaccines helps to train that immune system better. It helps to teach the immune system better.
Thank you so much. There was another comment that came through that said, the one response I get from parents, they ask, why does my child need this vaccine now? And they will say that they want to wait until their kid is older. What are your thoughts on that?
Yeah, that's a
Or
really
to
common
spread
thing
them
that I
out
hear
some
from
more?
parents, right? I've got my new baby or my 2-month-old. They're perfect. They're healthy right now. Why right now? Why can't I wait? We recommend vaccines at the times that we do for several reasons. The most important is that we want the immune system to be trained long before they get exposed to the disease. And so we do it at times where it's most beneficial for children. Every day, month, year that they wait is more time where they don't have protection and they're exposed. The other reason that we sometimes give vaccines at certain times is based on how well the immune system is going to respond. Okay? There are actually some vaccines that we wait and we don't give until later because the immune system doesn't really learn well at that time. There are other vaccines that we give earlier than you might think, like the HPV vaccine, where we give it earlier because the immune system responds much better. It does a better job of learning about the HPV vaccine when it's given younger.
Yeah, thank you very much for explaining that. I've heard that many times myself, so it's good to know that
Sure.
there are like specific reasons for why these shots are spaced out the way they are and the times that they're given. It's not just an arbitrary decision.
It is definitely not arbitrary. The amount of research and thought and good discussion that's gone into every single vaccine and every single time we recommend it's delivered is incredible. Hundreds, thousands of hours going into like, when is the best time? And sometimes we discover new things and say, hey, maybe actually we should change the time, right? Maybe the disease is changed and we should change the time. So a lot of thought goes into when we get vaccines.
Thank you so much for going through that. Next question is a specific one to rubella and the hepatitis A shots. Someone is asking if they are still developed by fetal cell lines.
Yeah, so really good question. And this is a common concern about fetal cell lines being used in vaccine development or production. Okay, there are no fetal cells in vaccines. I want to start with that. In medicine, there are actually quite a few things, including several vaccines, that in some way, in the process of developing or discovering them, did use these fetal cell lines. And a fetal cell line is what it is there's cells, when we call a cell line, there are cells that we started using decades and decades ago, that we use those same exact cells, but they have been kind of grown over time, even decades later. For some diseases, they are necessary in kind of using those for research. Some diseases like Alzheimer's disease research and some cancer disease research, we use those cell lines. That is a really common concern. And I also, if people are concerned about that because of their religious beliefs, basically all of the major religions have come out with very clear statements and have thought about the ethics of getting a vaccine that was developed in some way from fetal cell lines, and have come out with statements that say it's okay to get vaccinated. So I encourage families to check out those resources. And the Vaccine Education Center at CHOP has a link to some of those resources, so families can actually learn kind of what if it is tied in some way to their religious beliefs, what their religion actually says about that.
Thank you so much for that. We have another specific question about the schedule, immunization schedule. Margarita asked, is there a specific guideline for when the fourth dose of either I think you mean the Tdap, the PCV, or HIB is missing or late, and the MD decides not to give it in a state that the child's immunizations are up to date, even if the fourth dose is missing?
Yep. So when children aren't on the regular schedule, and this can happen for lots of reasons. Sometimes the parents choose to delay. Sometimes it's an access reason, right? And say I see patients that come from other countries where they weren't able to access vaccines. When they're on some type of a different schedule, they didn't follow it specifically, we have very clear guidelines for when we give vaccines and when we call the schedule complete. Again, a lot of thought's gone into that. For some of these diseases, there's a point at which we say, okay, you only need one dose, or we don't need to continue vaccinating against this disease because the risk now is incredibly low at this point. So that's why you'll see some of those times where, oh, they only got 3. Why are they complete? Well, usually it has to do with them trying to catch up and following those guidelines.
Thank you so much. I just want to make sure that we can still continue to go through some questions. I know we're a tiny bit over time. Are you okay,
Yeah,
Dr.?
that's perfectly fine with me. Yeah,
okay.
If everyone's still getting something out of this, I'm happy to stay on.
Thank you so much. All right, so the next question is from Ileana. She says, thank you very much, first of all. She also shared that she has a lot of parents' concerns about more additives in today's vaccines versus back when they were kids getting vaccinated. Is there any truth to this?
Honestly, no. There's not truth to that. We actually, over time, have been able to use fewer, and I'm going to say ingredients in the vaccines. That includes everything, because I think that additives, I'm not actually sure exactly what they're talking about with that, but like if you look at the total ingredients in vaccines, if anything, we have fewer and fewer total ingredients in vaccines than we did, say, in 1980. And I think I showed that slide with the antigens and how much fewer antigens we have. But there are some other ingredients that we no longer use. Kind of, I mean, here's how I think about it. Like any technology, we get better and better, right? My phone that I have here is very different than my phone that I had when, well, I won't go back to 1980, but in the early 90s, very different. Same with vaccines. We continually improve them.
Thank you very much for that. The next question is, what would your response be to a family who has not vaccinated their child due to the child getting sick? And I think what this is referring to,
Hmm.
it's like when people say, I don't want to get the flu vaccine because I get sick every time I get the flu shot. I think that's what they're referring to.
Yeah, probably that's a really common one. Every time I get the flu vaccine, I get the flu right after I get the vaccine. So I don't want, that's a common thing. And so here's how I would talk to a family about that. First, I'd say, hey, that's a really common concern. I hear that from a lot of parents. There, do you mind if I share with you what I know about the flu vaccine? And the parent usually said, yeah, sure, you can tell me. And I say, the flu vaccine cannot actually cause the flu. And often after getting the vaccine, a child might have a sore arm or leg. They might have a low grade fever and feel a little bit achy, but that resolves on its own within a day or two. The reality is that the flu vaccine prevents both getting the flu and hospitalization and disability or bad outcomes. So that is why we recommend the flu vaccine every year. So in that response, I tried to sandwich that myth that you're getting the flu from the flu vaccine around the truth about why we recommend it and the side effects that do happen that maybe they're thinking is the flu. Sometimes the other thing that happens is we often give the flu vaccine in the middle of respiratory season, and it's really common for you to get the flu vaccine and just by coincidence, right? I mean, kids, especially younger kids, get about 10 respiratory illnesses every winter season. And so by coincidence, there's a good chance within a week or two of getting the flu vaccine, the child's going to get some other respiratory illness.
Yeah, that's just the fun of the winter season and having
Mm-hmm.
children.
Mm-hmm.
Lots of germs. The next question you kind of already addressed it. It was please address the difference between a vaccine side effect and a normal immune system response after vaccine administration.
Oh, great question. So the normal immune system responses, like a low grade fever, like a rash where you got the site, like pain, we consider all of those side effects. Now, they are um, the immune system in the process of learning about the disease so it can fight it off. That's a natural thing that happens. When we talk about severe side effects, those are things that can happen from vaccines. I don't want you to hear me saying that there is not a single severe side effect of vaccines. We know that there are because we have good safety monitoring systems that have found some of these things. They're extremely rare and they're different for every vaccine. And the benefits of vaccinating far, far outweigh the risk of these rare side effects. But all of those are actually side effects from vaccines. And I'm usually honest with my families about that, right? I mean, I saw a bunch of patients this morning. And I frequently will say something like, "Hey, even though the family wanted it and they weren't concerned, I will often say something like, "Hey, this evening they might be a little bit fussy. They might seem like their legs are a little bit sore. They might get a low grade fever. I'm perfectly fine if you use some Tylenol, right? Like because those are side effects that happen."
Thank you very much. Our next question for you. We're almost there, guys. Three more questions. We're doing really, really great here.
Yeah.
VAERS has a statement at the top of their page that states this website is being modified to comply with President Trump's executive orders. How would you respond to this new modification?
So to be honest, for VAERS itself, I'm not exactly sure what that means. That headline is at the top of a lot of government websites right now. And I believe that it refers to language used on the website. I don't believe it refers to anything else about VAERS right now.
Thank you very much. This other question is very similar to the one that you answered about people that have the concerns about, I got the flu vaccine and then I got sick. They're just asking if there's anything else that they can explain to parents about how that works and why it's
Yeah.
not the vaccine that's making you sick.
Yeah. Well, so I think you can absolutely get a flu vaccine and still get the flu. I have had my flu vaccine every year since as long as I can remember, and I've still gotten the flu some. So I think it's fine to be honest with parents. Like, nope, it's not 100% perfect. You can still get the flu, but here's why I recommend it. It reduces the possibility that your child will have a serious complication like need to go to the hospital. Absolutely, it can shorten the duration and severity of the flu. I see families frequently who maybe they've got 4 kids and 3 of them got the flu shot, but they kind of forgot the other one because they were like at basketball camp or something. And that 4th one is so miserable. And the other one's got the flu still, but they're not as miserable. So I share things like that. I think it's also important. The other thing that I kind of explained, the anecdote that I like to share is, hey, look, and I think I said this in the talk. Seatbelts are not perfect. They are not going to prevent every bad outcome from a car accident. And yet I put one on every time I get in the car because getting no flu shot is 0% effective at doing anything to prevent complications from the flu.
Yep. All right. Thank you so much. And now we have our final question here. Thank you for sticking with us. I really appreciate it. Someone is asking if you can give separate shots, like for example, if a client is open to getting a measles and mumps shot, but would prefer not to get the rubella shot due to religious reasons. Is that possible, or is like the MMR just all one complete
It's a
vaccine?
really good question. Here in the United States, we only have the MMR shot together. When you look at all of our vaccines, there are some vaccines where we have available vaccines with only single components, but we don't actually have that available with all vaccines. And MMR is one of them. That is not an option to just get one piece of that.
Great. Thank you so much. And thank you all for submitting your questions. These are really wonderful questions. And yours, great, Dr. Higgins. Thank you so much for joining us today.
Yeah, thank you so much for having me. Have a great rest of your day.
Thank you so much for whoever's still on the call. Again, thank you so much for joining us. And a big thank you to Dr. Higgins for providing such a wonderful and informative presentation this afternoon for us and staying a little later to answer a few more of our questions. Thank you so, so much for doing that. Just want to remind you all, we do have a post webinar survey for you all. If you're still hanging in there, I see 64 still on the call with us. So please scan the QR code and then it'll also pop up once you exit the webinar. So again, thank you so, so much everyone for joining. And one more final thank you to Dr. Higgins for giving that presentation and to my team for supporting with the Q&A and all the logistics for this webinar. Thank you so, so much, everyone. Okay,
Good job,
bye
Anna.
bye.
Good job. See ya. Oh, I got to stop recording.